To improve performance, first understand what an erection is. The nervous system switches into parasympathetic mode. Arteries dilate, the corpora cavernosa or clitoral tissue fill with blood, and then venous outflow is restricted so pressure stays high. High sympathetic tone stress, anxiety, stimulants blocks this process, while parasympathetic activation favors it, which is why stress and inexperience often cause difficulties even when desire is present. Lower your sympathetic drive. Sleep well, meditate, breathe slowly, stimulate the vagus nerve, and choose a time of day when stress is lowest and energy is highest, often late afternoon, weekend windows, or in the morning if your routine allows. If evenings are your time, consider intimacy before dinner to avoid fatigue and post-meal drowsiness that crush parasympathetic arousal and blood flow. Blood flow is everything. Parasympathetic signals reduce intracellular calcium, relax smooth muscle, and increase arterial inflow by 20 to 40 times in men and somewhat less in women. Healthy arteries are required for that surge. Atherosclerosis, stiffness, or endothelial dysfunction slow the rise, weaken pressure, and reduce fullness. The corpora adapts to inflow, and pressure is the determinant of rigidity. In strong erections, cavernous pressure approaches or exceeds 100 millimeters of mercury. Here is a practical tip almost no one considers. Empty your bladder and your rectum before sex, because a full bladder or packed rectum occupies pelvic space, compresses vessels, and creates resistance against the inflow you need for a complete erection. Constipation makes this worse by limiting pelvic muscle function, so favor insoluble fiber, hydration, diaphragmatic breathing, feet elevated on the toilet, and avoid straining that can cause hemorrhoids and pelvic floor dysfunction. Stay hydrated to preserve blood volume. Less volume means less flow, slower filling, and more fatigue. Build aerobic capacity with continuous high-intensity but sustainable sessions of 10 to 15 minutes or longer rhythmic work with pace changes, improving endothelial function and pelvic perfusion. Support vasodilation, maintain magnesium, potassium, and zinc, and build nitric oxide with nitrate-rich foods like beet, celery, and spinach. Use antioxidants like glutathione or vitamin C if needed to protect nitric oxide from rapid breakdown by reactive oxygen species. Skip antiseptic mouthwash before intimacy. Your oral bacteria convert dietary nitrates into nitric oxide, and that pathway is essential for fast results. Now, retain the blood you re-bringing in. Venous occlusion happens when the tunica albuginea tightens around expanding tissue, and when two key muscles contract, the ischio-cavernous and bulbus spongicis. The ischio-cavernous is the star for rigidity. It compresses venous outflow at the base like a natural band, raising cavernous pressure and completing the final phase of a firm erection. The bulbus venosus supports the spongy body and helps express residual urine after voiding in semen during ejaculation. In women, its anatomy allows it to narrow the vaginal opening and enhance sensation. How to train them? Start with Kegel-style pelvic floor work. Lift the anus as if holding in gas. Contract for 3 seconds. Rest 45 seconds. Aim for 12 reps daily, and progress to longer holds as strength improves. Women can progress load using graded vaginal weights to prevent the weight from slipping out, building control and endurance with objective increases. For men and women, stronger pelvic floor activation improves venous occlusion, glans firmness, and the ability to maintain rigidity under physical effort and reduced stimulation. Some report benefits from DIR exercises from Qigong. Evidence is limited, but if they are comfortable and safe, you may try them as adjuncts. The most evidence-based hardware option is electromagnetic pelvic floor training devices. A single session can equal thousands of Kegel contractions and may accelerate progress when supervised. Common causes of poor erections include depression, which lowers desire and key neurotransmitters, and alcohol, which may help if stress is high but quickly impairs neurotransmission when the dose exceeds a small amount. Obesity and high cholesterol degrade vascular health, while atherosclerosis prevents the vessels from dilating enough to deliver the required 20 to 40-fold inflow. Nerve injury, often after prostate cancer treatments, disrupts the signaling pathway. Modern techniques attempt to spare the pudendal branches, but recovery can take time. Medications can contribute. Certain antidepressants, antihistamines, finasteride, and other psychoactive drugs may impair arousal or function. Always discuss alternatives with your clinician. Other factors include diabetes, low testosterone in men and women, aging, myasthenia, and multiple sclerosis. Address root causes while you build vascular and muscular capacity. Pharmacology helps but is not first line in healthy adults. PDE-5 inhibitors like sildenafil sustain cyclic GMP, prolong smooth muscle relaxation, and enable better inflow, but still require sexual stimulation and benefit from a trained pelvic floor to retain blood. Because the true chemical messenger is nitric oxide, build it with diet, training, and smart supplementation before you reach for medication. Many will not need pills once fundamentals are fixed. Porn-induced erectile dysfunction is real for some users. Chronic high novelty and supernormal stimuli desensitize reward, raising the threshold for arousal in real life. Test yourself. Compare erection quality and time to orgasm with and without any explicit content. If performance drops without content, pause usage to resensitize and avoid superphysiologic grip pressure with toys that do not mimic real conditions. Ejaculation does not drain your vital energy, and semen retention has no biological support. In fact, lower ejaculation frequency correlates with higher prostate cancer risk in observational data. Vasectomy works precisely because blocking the vas deferens does not harm overall health. Unused sperm are reabsorbed locally without issue. Regarding squirting, anatomical studies show that large sudden volumes are typically involuntary urine. The main vulvovaginal glands produce small amounts of lubricant gradually, not large jets. Putting it all together, relax the sympathetic system, time intimacy when energy is good, empty bladder, and rectum, hydrate, train your aerobic capacity, raise nitric oxide, and strengthen the ischiocavernis and bulbous spongiasis to lock blood in place. If you have a specific cause depression, meds, metabolic disease, address it directly with your clinician while you work the fundamentals. If this helped, subscribe and share. Better science means better sex and better health.